Hello, everyone, and welcome to the second installment of the Chicago Asthma Consortium's Ask an Expert series, where we take your questions about asthma, and in this case, COVID-19, and we ask your questions to some of the top experts in the field of asthma and allergy. Uh, Before we get to the questions, let's do some introductions. My name is Matt Seymour. I'm the chair of the board of the Chicago Asthma Consortium and executive director of Mobile Care Chicago. And Mobile Care has two mobile asthma and allergy clinics that travel around the city and provide specialty care to children. Dr. Martin, if I could ask you to introduce yourself.
Hello, my name is Molly Martin. I'm an associate professor at the University of Illinois at Chicago. I'm a general pediatrician and I practice at Miles Square Health Centers, and I'm also on the board of directors of the Chicago Asthma Consortium.
And Dr. Tantoko, if I could ask you to introduce yourself.
Sure. I'm Jamie Tantoko. I'm a physician in the section of allergy, asthma, and immunology at North Shore University Health System. And I'm also a clinician educator at the University of Chicago Pritzker School of Medicine.
Well, thank you both for joining us. As you can imagine, the Chicago Asthma Consortium has been fielding a lot of questions from people with asthma. I thought we'd start by just giving people a sense of how clinics are adapting to what's going on. And I'll start with Dr. Tantoko. How has your approach to clinical work changed since the pandemic measures have been in place? And how do you think that COVID-19 is impacting healthcare access for people with asthma?
Yeah, so in alignment with social distancing measures throughout our country, our practice has tried our best to limit our patient exposure to our hospital and clinics. So we have transitioned largely to telemedicine. We can do a lot of patient interviews and clinical work through telemedicine, which uses audio and visual. And so that limits patients needing to come to the clinic where they might be exposed, not only to potential coronavirus exposure, but to other patients who might be silent carriers of the disease. And so that's what we've done for our patients. We've also limited the amount of allergy immunotherapy or allergy shots that we've done. And that was in accordance with our National Academy for Allergy and Asthma and Immunology, that they did not feel it was an essential part of patient care at this time. As you know, we have many patients who are dependent on their allergy shots, so it is frustrating for them, but it really is done for their safety so that they're not congregating in the allergy shot room in close quarters, so we can limit the amount of people that are in our clinic at one time.
Right, and I'm glad you brought up both of those topics because those will come up as questions again in just a little bit. And but before we get to that, I'll turn it over to Dr. Martin too, and just have you talk a little bit about some of the adaptations that you've seen in clinical practice.
It's very much the same as what Dr. Tantoko described. We are not doing clinical care that's not deemed essential at this point. So children who need well child checkups that can wait a little while, we're asking them to wait a little while. But of course, babies who need to be seen and newborns that need to be seen, and then anyone who's acutely ill. So if you're having an asthma exacerbation or attack, or you're not feeling well for whatever reason and you feel like you need to be seen, those patients can be seen either in person or via telehealth. We're also converting some of the non-urgent or non-sick visits to telehealth visits, where we can talk to families and look at families on a computer screen or on a phone screen, or at minimum talk with them on the telephone. So we're converting as much of that as possible. The nurses are answering the phones and triaging to the physicians, and the physicians and providers are calling families back, and really trying to check on people and make sure that everybody's doing okay in this time, and then preparing for what will happen once we can go back to business as usual.
Yeah. And this gets somewhat to our second question, which is that, as you both know, we're entering a big season for, well, seasonal allergies, and over 70% of people with asthma have allergies. So if someone has COVID-19 or suspects they have COVID-19, how can they expect it to interact with seasonal allergies and or with asthma? And Dr. Martin, I'll turn it to you first on that.
Well, COVID-19 is like any other cold or illness, it serves as a trigger. So it can set off your asthma. So I think that's really important to keep in mind, recognizing that you may have the symptoms of COVID-19 in addition to having the symptoms of asthma. So if you're having symptoms of asthma, you need to do what you're supposed to do for asthma, which means to take your reliever or your rescue medicine, and then make sure that you keep up on your maintenance medicines. Now, as the allergy season is really starting to come into play here, it's important to figure out, are my symptoms actually allergies, or are my symptoms COVID-19? Or are they both? And is asthma mixed in there too? So with allergies, we have the watery eyes, the runny nose, sometimes cough, and a little bit of congestion, but not fever. Fever is not part of allergies. So fever is more likely COVID-19 or something else. So when in doubt, call your providers. We're here to answer your questions, to talk you through this. And a lot of this could be done through the telephone or through telehealth type platforms. Or if you need to be seen, you can be seen.
Yeah, and Dr. Tantoko, I'll throw this over to you also, but with a twist. So for the adult population in particular, we get questions, and I'm sure you get questions from people who hear on the news that asthma puts them in a high-risk group, and they want to know if it's safe for them to go to work, especially if they're considered employees in an essential sector. And so, are you hearing patients express these concerns, especially if they're not feeling well? And how do you advise someone with asthma on whether they should be going to work?
Yeah, that is a very good question, and a common question that we get, especially from many of our patients who are employees of our hospital or who are grocery store workers. And so what the data actually has shown is that patients with asthma are not necessarily at higher risk for getting COVID-19 infection. Now, the CDC has recommended that those patients with moderate to severe asthma may be at higher risk, but there really has been no data to support that. So what we have been doing is that it really has to be tailored to each patient, and you need to assess the level of their asthma control. So the most important thing that patients can do for themselves is take their controller inhaler if they have one, to make sure that they're not having the symptoms of asthma like cough, wheezing, shortness of breath, chest tightness. And by controlling your asthma, you're actually in a way protecting yourself from COVID-19 exposure. So we look to see how well their asthma is controlled. We see if they've needed oral corticosteroids in the last year. Have there been ER visits or urgent immediate care visits throughout the year that have indicated their asthma is not in control? If the answer to those questions are yes, then I would say that they would be at higher risk for having a COVID-19, a more severe course if they were to contract COVID-19. But if their asthma is controlled and they're an essential worker, then we have been telling those patients that their risk is, the same as the general population. That's what the data has shown, and that they need to practice sort of the basic guidelines we've been telling everyone else about how to protect yourself from COVID-19 exposure, which is, washing your hands, don't touch your eyes, your face, your nose, cleaning every surface. Now the CDC is recommending that people wear masks in public. And then of course, in the healthcare system, most hospitals have now moved into every hospital worker wearing a mask now in the clinical setting. So I think if there's concern, if you're an essential healthcare worker, that does need to have, there needs to be a conversation with your provider about what would be best for you.
Mm-hmm. Yeah, and if I could just respond to that and ask kind of a follow-up question. So Dr. Tantoko, I wonder if you're seeing this too. Some of our patients, we're a pediatric practice, but some of our patients are a little bit older and they are in the workforce. And they've been, a couple of them have requested now that we write a letter to their employer if they're at a grocery store or some sort of delivery service, recommending some of the sort of common measures that would keep people safe from COVID-19. Are you seeing people reach out to like get letters to their employers, or is that something that you would recommend that people in asthma and allergy provide?
Yeah, we've actually have been writing a few letters for our patients. Before most of us write any letters, we do talk to our patients directly to better understand what their work situation is and also what their home situation is, because that also will factor into how they're being exposed at work, and then if they were to go home, who would be exposed at work, at home. And so a lot of times through talking with the patient and also having them talk to their employer, there are some accommodations that can be made for many of our patients who are essential workers. But yes, we have been writing letters when it is clinically necessary for the safety and the health of the patient.
Thank you. And all right, so we'll transition to a totally different question here. And Dr. Martin, I'll pass this one over to you. If someone has COVID-19 or suspects they have it, should they stay away from someone with asthma or with lung problems?
Well, I think that only applies if that person is in the household with them, because if you have COVID-19, you are supposed to self-quarantine. That is the recommendation. So the workforce has different rules as to when you can come back, but once someone has been diagnosed, there's definitely clear guidelines, and the healthcare professionals would walk them through that. Now, if someone within your household had asthma, I think we revert back to those same criteria that Dr. Tantoko was saying. Let's think about it a little bit more. How well controlled is the person with asthma? Do they have other health issues that could also put them at risk for having a worse outcome from COVID-19? By the time someone's diagnosed, it's very likely that they've been spreading it already. So if someone in the household has asthma and someone else in the household is diagnosed, very likely that person with asthma already has been exposed and may just be a day or two behind in terms of their symptoms. So at that point, you talk to the healthcare providers, but make sure that that person has the best asthma medications available that they need, that they have their reliever medicines, that they have their spacers, that they know how to use them, and that they know how to contact their healthcare providers.
Mm-hmm. Okay, and then for our next question, Dr. Tantoko, I promised you this would come back up. What are your thoughts on the benefits and pitfalls of telemedicine given the COVID-19 pandemic and the new way that all of us are seeing patients?
Yeah, so for our practice, telemedicine has actually been quite useful for us, especially both for our established patients and new patients as well. We're always taught from medical school that the history is the most important part of your medical decision making, and that's actually very true. So we are able to make good assessments of our patients and devise good plans for them through telemedicine. And then through the visual component, I mean, you can gather a lot from a patient through their physical appearance, with their
Mhm.
asthma, how they're breathing, are they coughing throughout the interview, and prescribing the appropriate medications and giving the appropriate medical advice at that time. The downsides for us as an allergy practice is that we do really like our skin testing. And so that's obviously not something that is available that can be done through telemedicine. But that's really a supplemental data piece for the physician and for the patient. But many times the history will be very telling of how they can avoid certain allergens and how they can treat it. And so skin testing is not essential. That is something that could wait to a later time while we manage their allergies and their asthma.
Mhm. Yeah, and I think, in this new frontier that is kind of going on, I wonder if you could also talk to just a little bit, you know, how telemedicine is different for a new patient, someone you haven't seen before. The history is more rigorous, but without a physical exam, like what sort of barriers do those present for you?
Yeah, it depends on why we're seeing the new patient in the first place. So, things that I would love to get, but I can't get through telemedicine is the lung exam, especially to hear if there's wheezing. The head and neck exam, especially looking inside the nose for many patients who have allergies, it can be very telling. The extent of their rhinitis or the inflammation in their nose, and if there are any anatomic abnormalities like polyps can be seen on nasal exam, evidence of postnasal drainage on exam in the mouth. And so those are things that we do miss through telemedicine. But again, I think with good history taking and then sort of diagnostic trials of medications, we are still able to help many of our patients through telemedicine.
Hmm. And then we had a similar question that was submitted, slightly different, but the question was: people are told to call before going to a clinic or ER, but when they call, what can people expect to happen? And will there be asthma specific questions that are asked in that phone evaluation that will help doctors decide whether they should come into the office or whether something should be done via telehealth?
Yeah, so we do ask all our patients to contact us before they go to immediate care or the ER. And that's because we're really trying to prevent their exposure to potential infections, namely COVID-19 at this point in time. And so when they do call us, they can expect to get a series of triage questions that will assess whether or not they can actually be treated by us, or if we feel that they do need to go to immediate care or the ER. And so we do have, every hospital has their own COVID-19 screening questionnaire that will help to assess if they do need to be tested for COVID-19. And those would be questions like fever, dry cough, shortness of breath, travel anywhere, especially to those hot spots. Were you in large gatherings, 50 or more, or at this point, it could be even less? Have there been any known COVID-19 exposures? And then based on their history, we can also ask more tailored questions specific to the patient. Like, does this feel like your normal asthma symptoms, your allergy symptoms, and things like that? So after we assess them, then we can decide if there's someone that maybe we should be seeing in our own clinic. Would a telemedicine visit suffice, or are they someone that really should be seen in the ER or immediate care?
Hmm. And Dr. Martin, I know you're also doing telehealth appointments right now. Has your experience been very similar?
Yes, I think our clinics are very different because Dr. Tantoko's is a specialty clinic, and I work in a general clinic that sees all different types of patients and illnesses. but the process is still very similar. I think the one piece of advice that I would add is that patients with asthma need to be their own advocates always. So if the person screening on the phone doesn't ask about asthma, I would encourage the patient to mention it. I have asthma. I'm concerned about my asthma. I may have a fever, or I'm concerned about how I'm feeling, but I'm also concerned because I have asthma. And I would like to talk to someone about my asthma. So keep bringing it up and making sure that the point gets across, because not everyone who is doing the initial phone screening is a medical professional. So you need to make sure that they understand your direct issues. And if you feel that they didn't understand your direct issues, then continue to advocate for yourself. Ask, can I speak with a nurse? Can you leave a message for the provider and ask them to call me back? You have that right as a patient, and you will get transferred up or over if you ask and if they're not already offering it.
Excellent. Yeah, that's very good advice. Thank you. And so our next question, Dr. Tantoko, I'll again throw it over to you. This question is, I don't have asthma, but I have chronic bronchitis. Is it beneficial for people with asthma or bronchitis to begin taking silica or zinc?
Oh, right. So there are a lot of, I guess, reports that these supplements are helpful in fighting against infections and boosting up your immune system. And I think at this point in time, I hesitate to strongly recommend that to even just the general population. I always advise patients with chronic conditions like chronic bronchitis, asthma, or whatever it is, whether it's lung related or not, that the best thing that you can do for yourself is really eat a healthy, balanced diet, get adequate rest, and the vitamins and all those supplements you can acquire from the diet itself. And there are probably much better sources of the supplements like zinc than it would be to take an over-the-counter tablet.
Okay, and we have another question, slightly different, but how do you anticipate that the pandemic will affect certain ongoing therapies for asthma and allergy patients, like allergen immunotherapy, given COVID-19? And Dr. Tantoko, since you had mentioned this earlier, I'll throw it back over to you about allergen immunotherapy in particular, and how you're navigating that.
Yeah, so allergy immunotherapy is provided by our clinic. So those people who are not familiar with that, those are allergy shots where you are desensitized or made immune to the things that you are allergic to that would trigger your nasal congestion, even perhaps your asthma. And so that treatment really has been deemed more an elective decision. Even when we offer it, your physician might strongly encourage it because we know that it would benefit you. But ultimately, that is sort of an elective treatment for your allergic rhinitis or your allergic asthma. What we have continued is asthma biologic therapy. Now, those are also injections, and those are really indicated for the patients who have severe persistent asthma, those patients who are on the maximum medical treatment for their asthma. Maybe they're even on oral corticosteroids. And these injections help patients to have less asthma exacerbations. So those we have considered essential because those keep patients out of the ER and immediate care for their asthma flare-ups. As far as going back to allergy shots, that has affected many of our patients, and we understand that, but that's really for their safety. And when the time comes, when this pandemic is mitigated, our hope is to restart many of our patients on the allergy shots. And there's nothing that can we can always restart it again. So we're doing our best to reassure our patients that it's just a temporary stop and we can always restart it.
Mm-hmm. And then this next question, I suspect, is one that's near to the heart of all three of us. Dr. Martin, I'm going to pose it to you. With people spending more time in their homes than ever before, are you spending more time talking to patients about indoor air quality? And if so, what are those conversations like for people who might not be in a position to fix things like mold, mildew, or rodent infestations right away?
That's a great question, and I think it's not something that everybody's thinking about, and they should be. They definitely should be, because a lot of the triggers of asthma come from our environment where we live, right? And the more time that you spend in that environment, if there are things within that environment that trigger your asthma, then you're going to have more problems. So if there's pets and you're now spending a lot more time around the pets that you're allergic to, or dust or things like that. A lot of parents have their children leave when they do their cleaning, because being around when you're doing the cleaning, stirring up the dust and the chemicals of that can really trigger a child's asthma. And you actually want to give a couple hours after that for everything to settle down before the child comes back into that environment. But if the children aren't in school, they can't, where are they going to go, right? So this raises a lot of issues. And I can't say that we are talking about it proactively with parents, because we're not talking to as many parents as we would like to. But there are efforts, especially with community health workers and with programs such as Mobile Care, your program, Matt, and also some of the programs from the American Lung Association, to do outreach to a lot of our vulnerable families and ask them, are you doing okay with the triggers in the home? Do you know, let's problem solve through some tricks, because a lot of the things that we would have recommended, like send your child out if you're going to do cleaning, aren't an option right now. So we have to think more creatively about that. But I think everyone needs to recognize that the being in the homes may be exposing children to, and adults to, more triggers than they were prior exposed to, and this might be exacerbating their asthma.
Yeah. And Dr. Tantoko, I'll throw it over to you as well about, if you have any advice for people who are spending more time inside and might be in environments where indoor air quality is an issue.
Yeah, so that is all part of the allergy management, and this is really an issue that kind of comes up also in the winter time. So as we know, many people spend their times indoors in the winter, so the implementation for allergen reduction strategies would be the same at that point. So especially if you have a dust or a dust mite allergy, we always recommend washing your sheets once a week or every 2 weeks in hot water. You might not need to go out and buy dust mite encasements at this time, but if you are going to go to the grocery store, if you're going to order something online, that might be helpful in this case. You want to vacuum all the carpets. If you can get rid of some of your rugs so that you can just expose the hardwood, that would be preferable for someone with dust mite allergy, and even for pet allergies. So the less carpet there is, the less dander can really get stuck on the carpets or the rugs. And then so you want to always vacuum very rigorously. If your pet allergy is actually quite severe, we do recommend, isolating your pets at one area of the home, kind of having that be the pet zone, and then the rest of the house, especially the bedroom, a pet-free area. Mold tends to be in places where there's a lot of moisture, so the shower, the sink, and if there's someone in the home who is not allergic to mold, we always recommend trying to clean that with bleach, wearing a mask if you can. And then now that it's springtime and pollen allergy is upon us, we always recommend keeping your windows closed. The highest pollen counts are really in the morning. early in the morning until about noon. And then after that, the pollen counts do tend to go down. So if you do need to go outside and get some fresh air, just outside of your house, that is okay. I don't recommend going out to any parks or anything like that where you're going to be near anyone, but getting outside of your home just for some fresh air is okay.
Yeah. Well, I'm sorry to tell you both, that's our last question. And so I'll open it up and say, if you have any other advice, what would you share with people with asthma before we conclude? And I'll turn to Dr. Martin first.
I think just remember that every person's asthma is a little different. Every person's needs are different, and their responses to treatments and allergens and triggers are different. So when in doubt, talk to your healthcare providers. We're here to help. We want to help. We do have the time to help. It's just a little bit different than it was before. So don't be afraid to reach out, and don't sit at home suffering with asthma or allergy symptoms. Reach out and ask us. Maybe we can help.
Yeah. And Dr. Tantoko?
Yeah, I think to Dr. Martin's point, the main thing I want to get across is that the most important thing you can do for yourself is get your asthma and your allergies under control. So if that's not the case, please reach out to your physician. And if it is under control, then you can rest assured, as long as you're practicing safe social distancing, washing your hands, you're doing the best you can to protect yourself, and that you should feel that your health is going to be maintained through this pandemic.
Yeah. Well, for our audience out there, the Ask an Expert series continues. If you have a question about asthma, you can submit it on the Chicago Asthma Consortium's website, chicagoasthma.org, or through the Chicago Asthma Consortium Facebook page. If you write a question there, we'll bring it to an expert and have them answer it for you. So thank you, Dr. Martin and Dr. Tantoko, for joining us today.
All right, thank you for having us.
All right, see you next time.